Welcome back to Autism Live. We're going to take just a brief minute here to talk about tantrums because it's Challenging Behavior Marathon Day, right? We're talking about all the challenging behavior, looking at it as a three-term contingent. There is an antecedent, something that happens before. That's the A of our ABCs. There's a behavior, and then there's a consequence. So we're going to look at tantrums in this segment and meltdowns in the next segment. If you don't know the difference, stick around. I'm sure you actually do, but we'll talk about it. Okay, so tantrums in particular. We've talked about this a little bit earlier today. I want for all of us as autism parents to know that they are a normal part of childhood development. I know. I know there's something about that we go, no, I don't want to be in acceptance about tantrums. Well, I don't want you to be in acceptance about tantrums either. I want you to be in acceptance about the fact that it is going to happen and that it is a normal part of development and that we aren't going to, I look at Jack Riley, the little boy in the A word, and we've seen that some of his tantrums went away, right? And now he's on to new kinds of tantrums about different things. This shouldn't shock us because all kids are going to engage in tantrums to a certain extent. Because tantrums are a way of communicating. All behavior is a way of communicating. And until you are old enough so that you feel like you have some semblance of control and have some way of conveying your needs and getting them met, you are going to engage in some behavior that is going to look like a tantrum, right? And if we think about it, think about some adults in your life. There are adults who still throw tantrums because they don't have a way of getting their needs met. Well, the good news is if we can help our children and build skills with them, they will start to be able to get their needs met in other ways, right? I know we're singing the same song all day long, but I want everybody to know that we don't have to just get to the place where we say, okay, my child's going to throw tantrums and there's nothing I can do about it. That's not true. There are a lot of things that we can do. So, just like so many other, like all the other things we've talked about with behavior, there are some it serves a purpose. A tantrum serves a purpose, and there are some usual suspects. Kids throw tantrums to get attention. They throw tantrums to get out of doing something. They throw tantrums to get something they want. This includes gaining control over another person or situation, or gaining access to a ritual or routines. We'll see that for kids who do repetitive behaviors like opening and closing a door, and if we take away their ability to do that and put them someplace else and challenge that behavior, they'll throw a tantrum because their hope is that we will be so uncomfortable by their tantrum, and of course they're not thinking this through, right? But it has worked in the past that sometimes we go, oh, I really just don't want to deal with this, and then we let them go back and open and close the door because they seem to be happy. And we're not in the business of just making our children miserable, right? We try not to be. Every once in a while I tease my son and say, yes, that's my job. It's my job to make you miserable. And then he always laughs because he knows that that's not my job and that I'm kidding. But sometimes children they do tantrums to offer protest or frustration. You can't get your needs met in any other way. Boy, it's really frustrating. Okay, so, and tantrums feel good. Oh, they feel good, don't they? When was the last time you threw a tantrum? There is something about them that sometimes it just feels good, sometimes to just go, ah. I saw one of my friends on Facebook who, man, what an incredible mom of 2 kids on the spectrum. And yesterday, her Facebook status, she said, scream. And then she went, whew, I feel better now. You know, we all feel that way sometimes, that sometimes you just want to go, I want to not act polite about it, right? Imagine for a child, there is something about it that can feel really good. Unfortunately, though, children will continue to have tantrums and have them over and over and over again if we in any way reward them. And I know you, and you know me, we're smart people. We would never reward a tantrum, right? That would be the last thing that we would do intentionally, and yet we do it unintentionally all the time. All all the time. And we're going to forgive ourselves for that. We didn't cause the tantrum, but we can take control over how we react to the tantrum and help to diminish them or help to make them go away completely. Now that's a powerful place to be in, right? Instead of being like, oh no, I did it wrong, right? And beating ourselves with the wet noodle. We don't have to do that. But we don't want to be in the position of rewarding tantrums whenever possible. Okay. And we have to be cognizant of the fact that children with developmental delays are there because of sometimes their ability to communicate is compromised. They're going to throw tantrums. They have the potential anyway to throw tantrums longer and to have them last longer, right? Bad news. But the good news is that if we give them functional communication skills, we can decrease the frequency and the duration of the tantrums and sometimes make them go away altogether. Okay, so we need to talk about tantrums with this ABC contingent. What happened right before the tantrum? What does the tantrum look like? And what is the consequence of the tantrum? So think about the last tantrum that your child threw. What did it look like? And they call this, the behaviorists call it the topography of the behavior. What did the behavior look like? What did it look like exactly? Did the child throw themselves on the ground? My son was good at swiping. He would walk over and anything that I had anywhere on a desk, on a table, and he would just fling the whole thing. And then if that didn't get what he wanted, then he would take whatever was flung to the floor and he would do this with it, like a salad spinner, right? Throwing it up into the air. Loved to do that, and it drove me bonkers. Because it overwhelmed me, but again, we want to keep a 3-column sheet and say to ourselves, okay, what's the behavior look like? And write it down. Well, the behavior happened at 4:15 and she started yelling, and then she started throwing things, then she bit somebody, then she broke something, then she stomped her feet, then she tried to take pictures off the wall. Write it out. There's something therapeutic about it anyway, that you write out the whole thing, and obviously not while it's happening, right? But as soon as you can afterwards, you write it all out. Then the next thing you want to write down is, what was the consequence for it? What happened afterwards? Did anybody yell at the child and say, that's not appropriate, we don't allow that? Right? Did anybody take anything away? Did the child get a timeout? Was the child removed from the room? Was the child, did somebody pick up the child and rock the child? Did the child get cookies and milk afterwards? Did the child get to take a nap? What happened? Sometimes children will scream and yell and throw a tantrum to the point where eventually they exhaust themselves and they lay down and go to sleep. So what was the consequence? What happened as a result of the behavior? And then you want to go back and say, all right, now I got to be the detective and try to remember what happened right beforehand. Sometimes it's easy. Sometimes you go, oh, well, I said that we were done playing with this toy, or their friend left with a play date, or we had to leave the grocery store, whatever it is. Other times you go, I have no idea. It seemed to come out of left field. Oh, those are the ones we really got to be mindful of, because nothing comes directly out of left field. Okay, so we take a look at the behavior in all these different ways. And then we talk about what to do. That's after the tantrum is over. But let's talk for a second about what to do during a tantrum. So there are some things that we can do. And the first most important thing is for ourselves to remain calm. Oh my gosh, that's the hardest thing in the world, isn't it? Because depending on where you are and what kind of day it is, sometimes you want to throw a tantrum with them. Or sometimes you just want to cry and say, this is not what I wanted for my life. This is not what I wanted for my child's life. Sometimes we're concerned about what other people are thinking, or what other people are doing, or what other people are saying, or what they're going to think, or going to say, or going to do, right? It becomes this whole big everything in our life moment weighing on our shoulders. We really don't want to go there. We really want to stay really dispassionate. I always say, think like a court reporter in those moments. So you completely cut off the emotion and you emotional divorce from it and go, what's happening? Look at that. Look at my child freaking out. Look at that lady over there freaking out that my child's freaking out, right? You just notice it. and stay completely calm. It's the hardest thing in the world, but I got to tell you, and people had told me to do this, and I was like, yeah, right. Do you know what it feels like when my child is freaking out and doing all this stuff? And then I saw therapists come into my house that were trained to do this, and my child would be freaking out, and they'd be like, completely unimpressed. And I noticed that when they were that way, my child's tantrum was not as long and not as severe. And I went, I think I'll try that because I want to be in the category of not as long and not as severe, right? And I got really interested in perfecting this mask of calm. I see what you're doing, and I got no feelings about it. I'm a little on the bored side, right? And inside, you might be completely losing it, but on the outside, you're breathing and going, yeah, I see that. Right? Harder to do than it is to say, but work towards it. Trust me, it takes some of the oxygen out of the fire of their tantrum. Okay, whatever you do, you don't want to try to teach the child about the tantrums during a tantrum. While the child's throwing a tantrum, and you realize, oh gosh, I know why this is happening, because they haven't had anything to eat in 6 hours. What was I thinking? I should have fed this child before now, and you realize all that. And instinctively we say, oh, you know what, honey, you're just tired and you're hungry and mommy's going to get you something to eat. Right? This is not the moment. Think all those things and be thinking about, as soon as this tantrum, kind of winds down, I'm going to stick something in that child's mouth, but we're not going to teach them about tantrums and you're just tantruming because you want access to that thing over there that I say, no. The less talking, the better during the tantrum. It's not going to help. Think about when you're upset about something and you're really like at the peak of frustration and somebody wants to say, well, you're going to feel better. Oh, shut up, right? That's how we feel. So of course, it's not going to help. So we keep it to ourselves. Remove potentially hazardous objects or people. And I mean that. So if you're in the grocery store and your child is starting to have a tantrum, I remember one tantrum that my child had at the checkout stand, and they had all those little cards saying, would you like to feed homeless people? And he was ripping it off the thing and throwing them. And there were two little old ladies who were in line behind us, and I was trying to get out of that line as fast as I could. And so, you have to turn into an octopus, right? So I was trying to move things out of his range, and one of the little old ladies wanted to be helpful and had a conversation, and I literally looked at her and I said, could you please help me? And she said yes. And I said, I need you to stand back and please don't say anything. And I think she was a little affronted, but I didn't want her to get hurt. I didn't, if he started lashing out, boy, that was a place that it could have gone to. So at home, my husband and I, if my son would go and we would see the hand come out to swipe, and we would move simultaneously. We got really good at grabbing everything off the table and putting it out of reach as fast as we could, not giving the behavior attention, but making sure that we had minimized the amount of damage that he could do to himself or to someone else or to something else, right? And boy, they turn into little hulks, don't they? I can remember my son trying to overturn the therapy table because he was ticked. And my husband just went over and sat on the therapy table and was like inspecting his fingernails and sat there because there was no way my son was overturning the table with my husband sitting on it. It's like, well, just diffuse that. What are you going to do now, pal? And then he went looking for something else, and he would look like, what can I do? What can I wreck? What can I be in control of? I know from tantrums. I've been there, done that. So you get very good at, you don't go, oh my goodness, we have to move everything. No. We would go boom, boom, and move everything out of the way. And you might have to do it 22 times as they're looking around and finding the thing to tantrum. Remember, this is not something that we're going to do every single day, because we're going to get to the point where the tantrum doesn't happen anymore. But when it's happening, we got to be good at getting this under control. And then we're going to practice planned ignoring in some cases. And again, we go back to the planned ignoring. This is not the same thing as ignoring your child. It's ignoring the specific behavior. So my son is swiping things off the plate. We didn't pay any attention. I didn't say, don't swipe, don't do that. That's not polite. That's nag, right? of no use, has no effect except to feed the flames. We don't let it just happen, right? We block what we can, move what we can. My husband's sitting on the table, it's blocking it, but he didn't have a conversation, didn't look at him. Now, we're not ignoring the child, we're ignoring the behavior. It's a very fine distinction. You stay in the room, you never ever leave, and I'm getting ahead of myself. Okay, so during a tantrum, things not to do. We absolutely don't want to reward the child to get them to stop. Oh, man. And you see that on the screen and you go, well, I would never do that. That's just ridiculous. And yet we do. We do. And sometimes we don't think about it until afterwards and go, oh my goodness, I did that thing I said I would never do. So we try really hard not to do that. And I know they have a sixth sense. They can tell the moment in which they could get away with something because you're like, oh no, my boss is here. Just anything but right now. This is the worst possible moment, I swear. I'll pay $100 if you stop, kind of thing, right? That they do in the movies. We have to avoid that because the next tantrum will be that much worse if we do that. We do not put the child somewhere by themselves. So planned ignoring does not mean sticking the, I know people do timeout and they go, well, you're going to go to your room and I'll shut the door. Bad plan. You need to keep the child where you can see them and hear them for safety issues, if for nothing else. But we know that sometimes they're tantruming to get an escape, and if you're putting them in another room, you just fed it. You just rewarded it. That thing we said we weren't going to do, right? So the child has to stay in the same room with you. You got to have visual. You have to be able to hear and see them, right? Even though you might be practicing planned ignoring, need to be in the same room so that you can, if something happens and escalates, you can be there to help. We're not going to, this is the hard one for me, we're not going to scold, nag, yell, lose our temper, or berate the child for their behavior. Oh, it's so hard. Yeah, it is. It's so hard, but we have to, if we want to be effective, and if we want for the tantrums to stop, and we want for this one to dial down faster as opposed to slower, we, not saying anything. Don't give it the attention. It might be attention driven, which means you're once again rewarding it. You're standing there going, I am not putting up with this behavior, da, 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 but the child's doing it for attention. Guess what? They're going to do it more. We have to keep our mouths closed. So hard for me. I don't know about for you. Okay. Acceptance and control. For every behavior, there's a before and the after. Generally, we can't control somebody's behavior. Usually, we can control either what happens before or the consequence, and a lot of times we can control both. Okay? So when we look at tantrums and we look, okay, why did this happen? What happened before? What does it actually look like? What is my consequence going to be? We need to do an FBA, a functional behavior assessment on the tantrum. If the child is tantruming for attention, if we discover, okay, well, attention is the function of this behavior, then we are going to stop giving attention. We're going to put that behavior on extinction. So when that child, and when we put something on extinction, it means we cut off the reward to it. So if in the past the child has tantrumed and we talked to them and said, hey, there's no more tantruming, we don't do that, da 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 da. Now we're going to do planned ignoring instead. And we're going to start to give this child attention on a regular basis. And we looked at it and said, okay, we have, whenever we get together for this one play date and mom is talking to this one person, this child tantrums. And it's because they want mom's attention. So for the next 5 or 6 play dates that we go to, instead of standing and talking with the other mom, every 30 seconds or every minute, mom is going to go over and give attention to the child saying, you're doing such a good job playing with your friend, and not go sit and talk with the other moms. While at the same time, we're going to teach the child appropriate ways to get mom's attention, to ask for attention, to come over and make the sign, or make the gesture, or point to the picture to say, Mom, I want you to play with me and not play with the other mom. all different kinds of circumstances in which attention can be, but we want to give attention on a regular basis. So that's an antecedent modification. So before we get to the place where the child feels like nobody's paying attention to me, there's always this attention. We can fade it over time. But we're also teaching how to get attention appropriately, and whatever happens, if the tantrum happens, if we didn't give enough attention and the tantrum happens, we do not give that attention. Paying attention to the child, but not the behavior. Okay. Imagine that the tantrum is happening because the child wants to escape something. We talked about this earlier. We do not allow them to escape the behavior. We teach them appropriate ways to ask for a break, and we try to make whatever the thing is that they're trying to escape much more reinforcing. If they're engaging in a tantrum to get access to something because they know they want that lollipop, and when they threw the tantrum, the old lady one aisle over gave them the lollipop, and we want to the old lady in the next aisle over, right? But we need to not give access to the thing, while the tantrum is happening. We need to ask, to learn skills how to appropriately ask for something. So it may mean that you're giving out lollipops in the checkout stand for a little while because they asked appropriately for the lollipop. And then over time, we'll, say, this today you're going to get it, today you're not going to get it, and we'll work up a whole thing and promise them, say, today when we go into the grocery store, before you ever go in the grocery store, you say, after you've done this for a while and they've gotten the lollipop for asking appropriately, you're going to say, today we're going in before we go in, and you're not going to get the lollipop. And you're not going to throw a tantrum. And for being such a big boy or girl and not throwing the tantrum, later on, you're going to get this, right? And we build those skills slowly. The toughest is when it is self-reinforcing. And I'll tell you with a tantrum that it's very rare that it's just reinforcing in and of itself. I think there's almost always another component to it. But if it is just self-reinforcing, all the more reason why you're going to need to have a BCBA in there to look at it and go, okay, here's how we're going to get at this. Because that's a child who doesn't have any other skills and needs ways of making themselves feel better. And it can be worked on. It can be fixed.